Hello all and welcome to the 7th session of PCBR course being organized by AIMS Mohali. I'm Dr. Nidhi Malhotra. I'm Associate Professor of Psychiatry and I shall be speaking about experimental research designs today. Just a quick recap. Studies can either be descriptive or analytic. Now, descriptive studies are either cross-sectional surveys or case series and case reports. And analytic studies are further dependent on whether there is only observation being carried out. And we have cohort studies and case control studies under this category. And then we have analytic studies in which we do some kind of manipulation or intervention. Now, these study designs are called as experimental study designs. Now, they are further classified as pre-experimental research designs, true experimental research designs, and quasi-experimental research designs. Now, starting with the pre-experimental research designs. These are the research studies in which a single group or various dependent groups are observed for the effect of the application of an independent variable, which is presumed to cause change. So we have one-shot case study research design, one group pre-test post-test research design, and static group comparison under this category of research studies. Now, what happens in one-shot case study research design is that there is one intervention and thereafter there is only one post-intervention measurement, and it is believed that the change in the measurement is being produced by the intervention that is being carried out. Then we have one group pre-test post-test research design. In this, there is an intervention, but there are two measures, one which is taken before the intervention and one which is taken after the intervention, and the degree of change at the two time points is then calculated. Then we can have static group comparison. In this, there are two groups and intervention is carried out in one group and the other group will not receive the intervention, and there will be only one post-intervention measurement in both the groups. Now, this is similar to true experimental research designs, but the difference is that in static group comparison, there is no randomization. Now, quasi means pseudo, and in these research designs also there is no randomization. Under this category, we can have time series or multiple time series design. What happens in time series design is that there is an intervention, but there are multiple pre-intervention measurements and there are multiple post-intervention measurements, and the degree of change between different time points is then calculated. In multiple time series design, there are two groups and different interventions are carried out in both the groups, or either one group will receive the intervention and the other will receive placebo or no intervention at all. Again, the difference between time points is calculated and the degree of change is then compared in the two groups. Then coming to the true experimental research designs. Now, there are some characteristics of true experimental research designs, that there must be a control group and there must be a variable that can be manipulated with the help of an intervention, and there is random allocation of the participants. Now, before we discuss the various types of experimental research designs, I would like to speak about randomization. Now, randomization is a process which ensures that participants have an equal chance to be assigned to one of the two or more groups. Now, one group will get the new treatment which is being tested, and the other group will get most widely accepted treatment or the gold standard, or a placebo or no treatment at all. And randomization provides the best way to prove the effectiveness of a new agent or intervention by ensuring that all groups are as similar as possible, and confounding co-interventions and bias in outcome ascertainment is minimized with the help of randomization. Now, true experimental research designs, we have post-test only control group design. What happens in this design is that the participants are randomized into two groups. One group will receive the intervention, and there would be then one post-intervention measurement only, and the difference between two groups will be calculated. In pre-test, post-test control group design, again, there would be randomization. There would be one pre-intervention measurement in both the groups, the one receiving the intervention and the one not receiving the intervention, and one post-intervention measurement. And the degree of change between two time points then will be compared in the two groups. Then we have Solomon 4-group design. In this design, there will be 4 groups, 2 intervention groups, 2 control groups. Now the 2 groups will receive pre-intervention measurements, and all 4 groups will be receiving post-intervention measurements, and the difference will then be calculated. Now clinical trials are done in 4 phases. In phase 1, there are 20 to 80 participants. It goes on up to several months and studies the safety of medication or treatment. In phase 2, there would be 100 to 300 participants, and it studies the efficacy of any intervention. In phase 3, what we do is that there would be around 1,000 to 3,000 participants, and it will study the safety, efficacy, as well as dosing of the drug. And in phase 4, there would be thousands of participants, and it will be measuring the long-term effectiveness and cost effectiveness of any kind of intervention. Now, another important aspect in case of clinical trials is blinding. Blinding means being unaware whether the participant belongs to the intervention group or the control group. Now, blinding can be at the level of the participants, that is single blinding, participants and investigators, that is double blinding, and participants, investigators, and analysts, that is triple blinding. Now, blinding helps to eliminate subjectivity in judgment of outcomes in co-intervention. What happens is when participants or the researchers are aware of the allocation of the participant, then the participant may use other therapy or change their behavior, or the study staff, medical providers, family or friends treat the participants differently. Now, second is the biased outcome ascertainment, and the participants may report symptoms or outcomes differently, or physicians or investigators may elicit the symptoms and outcomes differently if they are aware whether the participant belongs to the intervention group or the control group. So this can be minimized with the help of blinding. Now, the bias can be either attrition bias, which is caused by unequal loss of participants from a RCT. Volunteer bias is when the participants which are volunteering to take part in a study have different characteristics from general population of interest. Then we have ascertainment bias, which arises when the data collection or analysis is done such that some members of target population are less likely to be included in the study. It is related to sampling bias, selection bias, detection bias, or observation bias, and it can also be addressed by blinding and allocation concealment. So this is all from my side. Thank you.